Welcome to part 2 of our dosage calculation expedition, our exploration, our little initial step into it. We're going to go over reading medication labels and medication orders in this video, so don't be alarmed. We got to figure out how to pull what's important out of it. That's the word problem part, and it's not too bad. You'll find it's all pretty much the same stuff. So what we're going to cover: what all's on a medication label? When you see that bottle of pills, you know you're supposed to take 2 of them, but what all information is on there? How do we decode medical orders? What are they actually saying when they tell us to give medicines? How do we find the information we need? And then avoiding some common traps you might find in NCLEX questions. We're just hitting the surface today. Hopefully all of these things are things that afterwards you'll go in and practice. Practice, practice, practice. The more you practice and the more different versions of this you're exposed to, the more sense it's going to make. So make sure you're practicing as you go through all of this. Why does this matter? Before you can calculate anything, you got to know what is even being ordered. So the doctor in real life will have a whole list of things they'll give out. The medication order in the computer will have a whole lot of different information. And we have to find out what's actually being asked for. What communication is happening here? The orders and the labels and the doctor telling you something is all just communication, and we have to make sure we get the right communication out of that so we can bring the right thing to our patient. We have to know what we have available. What do our pills look like? If I need to give, let's say, 650 milligrams of Tylenol, do I have a 650 milligram tablet? Just a little hint, no, they're usually in 325s, so 650 milligrams of Tylenol means you need 2 tablets, which we're going to get to. That's your dose on hand. And then you need to know what form it's in. When we get into medication administration, which maybe I'll do another series on that too, we have to know how we're giving it. Is it a PO, that's per oral, some kind of Latin version of oral? Is it sublingual, sits under the tongue? Is it an injection? Is it IV? Is it rectal? You don't want to get it in the wrong hole. Simple as that. If you're going to give your medicine right, it's got to go in the right spot. So here's our medication label. I'm going to see if I can bring out a pointer on here. Let's see if it'll do something. So we have different parts of it. All of our drugs have what's called a generic name. That's the name that every drug that's the same drug, no matter who makes it, sells it under. That's this acetaminophen right here. The big label in the middle, acetaminophen. We'll also often see a brand name. This label particularly doesn't have a brand name on it, but this is something like Tylenol. Like if you get a Mucinex, what's in Mucinex? It's usually guaifenesin. That's the generic name. This is across the board. The brands are the names for the drugs owned by companies. So know that you can have different names for the same drug. Like they don't call Tylenol Tylenol everywhere. Actually, only the company that owns the Tylenol name can call their drug Tylenol. But everyone will call it acetaminophen. That's the generic name. Likewise, you have to be careful with some of these brand names because you'll have multiple names for things that they might be the same name, but they're different. So you think Dayquil and NyQuil. There's not just one formulation of Dayquil. It's whatever they wanted to put in there. Now, so that's where you got to go a little farther in and read what different generic drugs are in there. This one's got acetaminophen in, and it's got dextromethorphan, and it's got some diphenhydramine in it. So then you actually know what's in your drug, because compared to different versions that are called the exact same thing, they can have different drugs in them. Next up, we need to know our dose strength. That's how much is in each unit of measure here. So for this Tylenol, that's 325 milligrams. So each tablet has 325 milligrams. What form is it? Look, it says it right there in big white and red letters. It's a tablet. So we need to know if it's a tablet, a capsule, a liquid, an injection. Where's it going to go? Next up is route. Now route should be in here somewhere or the other. We usually, I don't want to say assume on medicine orders, but if it's a tablet, that's typically going in the mouth. Now, when you get a medicine order from the actual doctor, it is always specified. That's an important part of your medication order that you need to check. If it comes on the label and it doesn't say oral, we know these tablets are for a mouth. But if you see this order in the computer, it will specify PO, which means by mouth. So we can give Tylenol in a few different ways, including a suppository. And you don't want to cross them. You don't want to get them mixed up. You don't want to get the wrong thing in the wrong hole. And then each medication label will tell you how many's in there. So this one has 50 tablets in it, etc. You know, how big is the whole bottle? Now, what parts of that are actually important? You have to know your dose strength. How much is in every pill? So if we go back to that last page, those are 325 milligram tablets. So I get 325 milligrams per pill I give. So if my order is for 650 milligrams, I'll take that and divide it by 325 and find out that means I need to give 2 tablets. And we're going to get to that math part in a little bit. That's the next video, I believe. So how much comes? Now, if you have a liquid, that'll be in a concentration. That's for IVs, that's for syrups. Think about if you give your kids Tylenol. Mine's 6, she still won't take pills, so we measure in a little cup, but that'll come in 250 milligrams per 5 mLs or whatever it is. That's an important thing you have to take from the label. And then the form. So you need to know what you're given. How are you giving it? That's that don't cross the lines piece. The rest of it, do I care how much is in that bottle? Not for normal day-to-day tasks. If I'm sending somebody home, I want to make sure I send them home with enough medicine, but to be honest, that's usually the pharmacist that figures that part out. Do I care a whole lot about the brand name versus the generic name? Well, it's important because I have to give the right medicine and I have to teach my patients to take the right medicine. But when I come to dosage math, no, I don't care about that. The rest of it, you know, the dosage math part itself, we leave most of that stuff from the label off. Now, here's a good example. This is a bottle of Tylenol. Let's see if I get my laser pointer back on. So Tylenol is the brand name that we just talked about. That company, I don't know if it's Procter & Gamble, I don't know who owns Tylenol, but somebody owns Tylenol. And they're the only ones that can market it as Tylenol. But you see just below it is acetaminophen. That's the generic name we were talking about. So what actually matters from this label? I have acetaminophen, I have 500 milligrams in each, and these are caplets. I don't know what a caplet is. I guess it's kind of like a tablet, but it's a little smoother. Whatever. So the pieces I pulled out, 500 milligrams right here, and they're in tablet form, some version of a tablet form. That's all. The rest of this doesn't really matter to me. Here's another example. This is a liquid example. So this amoxicillin is a very common, especially if you have kids, you've given them amoxicillin, I'm sure. Every little infection, they get amoxicillin, and as they grow up, they learn to hate the taste of it. At least my kid hates it, and she makes terrible faces when she takes it. But what do we actually need on this? Well, I need to know what the drug is, and it says amoxicillin right there. I need the concentration, 250 milligrams per 5 mLs. And I know that it's a liquid because it's constituted. It says suspension right there. That's a form of a liquid. So what do I actually need out of all this mumbo jumbo? 250 milligrams for 5 mLs, and it's in liquid form, and the drug name. That's it. So don't let the rest of this trip you up. Now, always look for per or a little slash. That means how much is in whatever amount of product it is. So if I want to give 250 milligrams of amoxicillin like that previous example, I'm looking for something like this, 250 milligrams to 5 mLs, milliliters. Or that's the same thing as 250 milligrams in every 5 mLs. This is my dose on hand, which we will plug into the math in the later video. Don't confuse this number with the total number in the total volume in the container. I think this one said it would carry something like 150 mLs. It's enough medicine to probably get them through their whole the whole order, the duration of medicine they need. But that's not, we're not chugging down the whole bottle at once. We're measuring out a very specific amount so we can get the amount of medicine we want over time. So something like antibiotics especially, they'll do it over time, so you keep a core amount of medicine inside somebody's body. And it will kind of naturally go up and down. So you take a dose and the amount in your body goes up and then it'll taper down. And then they have it figured out. So the time you take the next dose, it'll come up again so you keep the right level of medicine you want. And that's why we meter it out like this. So if they're taking something like amoxicillin and they probably need it BID, that means 2 times a day, you want to do it as close to 12 hours apart as you can so you keep the level of medicine that's in that person's body consistent as possible. Smarter people than me have figured that out, and they do big trials to figure out drug availability and all this kind of stuff. Our part of it is giving the right amount of it at the right time. Now, medication orders. This is how you'll get it in the chart, and this is what the doctor will give you. So it has different parts. And when we talk about medication administration, that's kind of a separate module from dosage calculation that'll come in a few weeks. There are very specific parts that we have to have, but for our dosage calculation part, we can pull out exactly what we need. So look, this example 1, give acetaminophen, 650 milligrams, PO, Q4H, PRN, pain. What does that all mean? Well, the drug, that's easy. I want to give acetaminophen. We learned that's the same thing as Tylenol. 650 milligrams, that's my dose. That's how much Tylenol I want to give. On that first order, and we're going to figure out later how to do that, so that means I want to give 2 of the 325 milligram tablets to give this. PO, that's by mouth. Q4H, that means every 4 hours. Again, we're going to talk about that more when we get to medication administration. PRN means as needed. Again, that'll come up with medication administration, but Q4H, PRN, pain. To give you the gist of it, that means we, as nurses, have the discretion if our patient is in pain. As often as every 4 hours, we can give them 2 tablets of Tylenol if they ask for it, if they seem like they're in pain. Our next example, give amoxicillin 500 milligrams PO TID. So amoxicillin is my drug, 500 milligrams is my dose, PO means by mouth, TID means 3 times a day. So the medication math doesn't even need most of that. The medication math really just needs the 500 milligrams. You have to be careful when you are answering a question. Sometimes the questions will say, how many mLs or how many tablets will you give to give this dose once? And sometimes they'll say, how many mLs will you give over the course of the whole day? And that's where that time factor comes in. So if it's 3 times a day, you're going to take whatever your 1 dose is and times it by 3 because it's happening 3 times in a day. A little more advanced. Don't worry about it. It's not too hard. You just have to step back and make sure you know what the question is asking. Our final example here, give furosemide 40 milligrams IV now. So we know our drug is furosemide, and that's Lasix. Y'all will do med templates on that here pretty soon. That's a diuretic, makes you pee, pulls fluid off. 40 milligrams, that is my dose. That's the only part that really matters to me for this dosage calculation out of this order, 40 milligrams. IV, that's the route. That means it's going to go in through a vein. Now means I do it right now. I don't put it off to do later. It's scheduled for now. So take a minute, make sure you can pull those pieces out, and you can find other examples of medication orders. They're all set up the same. They all have to have the same core pieces, which we'll learn more about later. But for now, we can pull out acetaminophen, 650 milligrams. That's all I need there. Amoxicillin, 500 milligrams. That's all I need there. Furosemide, 40 milligrams. The 40 milligrams, that's it. It's not rocket science. Y'all can do this. All right. Here's another breakdown. We just covered all of that. This is what you need, 650 milligrams. You just need the dosage of it to know how much the patient's actually supposed to get. This other stuff is important. Don't get me wrong, but that comes up more with medication administration. While we're focusing on the math, don't let it trip you up. And the math, if it's a math question, don't let this other stuff distract you. It's an essential part of the whole order, but right now you only care about this one little part of it. So what do I need from the order? The dose. The route has to match. For the calculation part, I don't need the time yet. Unless there's a question that asks how much total drug will somebody get in a day, I don't really care about the time if I'm just figuring out how much. Same thing with indication. Y'all will get more information on how to determine if you give drugs at a certain time, because you could see a question, what drug should this patient get or something. I might make that kind of question. That's actually giving me a little inspiration here. But I don't care that much about frequency or indication if what's one dose going to be. I just need how much drug it is and how am I going to give it. All right. Now you'll match the order to the label of the medicine. Remember we talked about amoxicillin earlier. The order is for amoxicillin 500 milligrams PO/TID. So what part of that do I care about? If I'm preparing one dose, which is typically what nurses are doing, I care about this part. 500 milligrams. Now I'm looking over at the label. I have amoxicillin, so my drug's the same. 250 milligrams per 5 mLs oral solution. So my route matches because I've got PO, which means oral here, and I've got oral suspension here, which means it's supposed to go in the mouth. 250 milligrams to 5 mLs, that's what I need. Pull that information together, plop it on your paper, and we'll start figuring it out in one of the next videos. Y'all might be able to do this in your head. 250 milligrams to 5 mLs, and I want to give 500 milligrams. 250 goes into 500 2 times, so I just need to times 2 that 5, and I get 10. So this dose is 10 mLs, but we're going to get to that math, don't worry. And when you're in nursing school, write the math out, because that's a stupid thing to lose a point on. NCLEX tricks to watch for. And this is all questions because we try to make our questions as much like the NCLEX as we can. So this is not just the big test at the end. This is every test along the way too. There's going to be extra information in these questions. You have to pick out what's actually important. And now you know what's important. So if I want a one-time dose and they include patient is Ralph, he's a 65-year-old male, he weighs 77 kilograms, he's in the hospital for a diagnosis of a right leg ulcer. He got these many previous doses. There's this much medicine in the bottle. I don't care about that. What do I care about? He complained that he has pain. The order is for Tylenol, 650 milligrams every 4 hours. His last dose was more than 4 hours ago. How much drug am I giving? So I just need to pick out that little bit of important information and forget all the rest of it. If it's not weight-based, I don't care about his weight. I can't think of orders with the age parameter. I'm sure they're out there, but I don't care about the age. I tend to tell people about patients, and I'll report on my patients, including their age, just to give them more of that story. But that doesn't matter to the math. The diagnosis doesn't really matter to the math. So a big part of your job is parsing through all this information and pulling out what's actually important. Here's a practice. Give acetaminophen 650 milligrams PO Q4H PRN pain. Available, acetaminophen 325 milligram tablets. The patient weighs 70 kilograms and rates pain 7 out of 10. What parts of that do I need? I don't need all of that. I need to know what my drug is. I got my acetaminophen. I need to know my dose. My order is for 650 milligrams, so I would write 650 milligrams down on my piece of paper. PO, so it's oral, and my tablets, that's oral, that matches, so I don't even really need to think about that. Q4H, there's no piece in here that says anything about time, so don't add things to these questions that are not in there to start with. PRN pain, so he's in pain, so it makes sense. That's why he's getting this drug. I don't need to write that down. What's available? Acetaminophen 325 milligram tablets. So I need that 325 milligram tablets is what I have. The 650 milligrams is my dose. And that's it. The rest of it's just extra information. I don't need, for this, I don't need PO, I don't need Q4H, I don't need PRN, I don't need their weight at all. I don't need their pain any more than to know that they have pain, so this order sounds like it's probably appropriate. Just pull those little pieces out. All right. Give cephalexin 500 milligrams PO Q6H. Available, cephalexin 250 milligrams to 5 ml suspension, 200 ml bottle. What do we need out of that? Well, my order, 500 milligrams is what I want to give. What I have, 250 milligrams to 5 mLs. I don't need the 200 ml bottle. That's not relevant to what I'm doing right now. I don't really need the time piece for this question. When you're on the floor, you will, but not for this question. So that's it. Pull it out. Don't get distracted by all the other stuff. It helps me to write it on paper, especially for a test. This is high stakes testing, and your success in nursing school depends on it. So take the time and write it out. It's not that big a deal. So what are our key takeaways? We need to focus on our dose, match the order to what you have, identify what was actually ordered and what you have on hand clearly. That's going to be important for the math part of this. Don't let the extra information trip you up. Just because it says 70 kilograms, do a quick check to make sure there's not something in there that says it's for weight. But if the order doesn't say anything about weight, ignore it. It's not relevant to you. Make sure your routes match and you're in business. So, to wrap it up, you guys can do this. You got to pick the right information out, but you saw it's not that bad. Sometimes you got to poke around and read a little deeper for it, but it's in the same format. A little bit of critical thinking, slow down what you're doing. You're not just grabbing 2 pills, you're putting the pieces together, because that's where we can actually save people. I really don't want to make it over dramatic, but nurses have a big role, and we can do a lot to give safe care and to prevent people from getting hurt and to help them to get better. That's our goal, and y'all can do it. Our next video is going to be conversions that actually matter. There's a lot of different conversions. Well, I'm just going to focus on the important stuff. There's some other stuff you may have to know at some point or another, and we're just going to go through it. There is going to be some memorizing with that part. I'm not going to sugarcoat it. You got to remember what milligrams to grams and that kind of stuff is. But you can do it. I believe in you. I'll see you next time.